So we'll be presenting the results of our survey examining documentation burden reduction strategies during the COVID-19 pandemic. So our goal was to assess clinicians and other healthcare leaders' perspectives on COVID-19 related documentation changes. And this survey was distributed from October to December of this past year. And we derived the response options from a Health Affairs article by Christine Sinsky and Mark Linzer, outlining practice and policy changes from COVID and whether or not we should implement some moving forward to reduce documentation burden. So we had 246 respondents complete the survey. The majority were informaticians, nurses, physicians, and nursing leadership. Most had a specialty of internal medicine and worked in a health system, academia, or hospital setting. So we asked respondents to indicate whether they had experienced any of these COVID-19 documentation reduction strategies and whether they would support keeping them in place after COVID. So the top 3 experience strategies were expanding telehealth, changing E&M coding for telehealth visits, and disease-specific workflows such as COVID-19 express lanes. These were also the top 3 supported to keep in place. We also asked respondents to rate the projected impact of each strategy for reducing documentation burden on a scale of 0 to 100, with 100 being the highest impact. And all 3 telehealth expansion strategies got the highest rating, along with waiving nursing plan of care requirements. We asked about additional documentation reduction strategies not explicitly tied to COVID-19. The top 3 experienced were EHR optimization sprints, documenting only pertinent positives or charting by exception, and monitoring or improving EHR use measures. We can see EHR optimization sprints was again the top priority for implementing. However, implementing only evidence-based EHR alerts was the second most supported to implement long-term, followed by charting by exception. Again, respondents rated the projected impact with charting by exception at the top, followed by changing compliance rules and performance metrics to eliminate those without net benefit, and EHR optimization sprints. Now I'll pass it over to Amanda Moy.
Thank you, Jessica. We performed a thematic analysis on additional COVID-19 clinical documentation reduction experiences that participants described in free text. And we grouped these data based on the American Nursing Informatics Association conceptual framework on addressing burden, which you can see on the x-axis comprises of 6 domains. And of the 62 responses received, most centered around burden that was self-imposed, interoperability or standards, or usability. Fewer centered around regulatory and reimbursement. None reference quality-related reduction strategies. Themes in the self-imposed domain included using more patient-entered data, reevaluating system policies, and adding documentation navigators. And a navigator is a series of sections meant to follow a particular workflow in the AHR. One example quote that we categorize as reduction of self-imposed burden is following reevaluation of system policies that dictate documentation performed by the clinicians eliminated much of the requirements not otherwise required by other regulatory bodies. And some standards-based strategies were adding navigators, standardizing and modifying procedures, streamlining workflows, and reducing data elements. And one example strategy identified relating to interoperability and standards was that their organization developed guidelines for adding fields, and if the field informs safe clinical stay or plan. Additional burden reduction strategies categorized as usability related were adding navigators using AI technologies, more structured use of data and templates, improved data visualization, use of data mobile devices for documentation, and removing alerts. So in the usability domain, one participant wrote that their organization was developing a voice-based audio file documentation system called Minute Note. And strategies in the regulatory domain mainly described adherence to telehealth and CMS guidelines. So in the regulatory domain, one participant wrote, "We followed the CMS recommendations for documentation during the pandemic." The strategies, the reimbursement domain focused on what can be billed and whose notes can be used for billing. And lastly, one example quote from the reimbursement domain mentioned auto text, which can insert necessarily boilerplate text required for telehealth billing. And now I'll pass it on to Gene.
Thanks, Amanda. So on this slide, we have a graphic that summarizes the strategies that were not elsewhere identified in the survey and their effect on documentation burden. As you can see, the majority of the respondents reported no additional strategies there, but of those that did report additional strategies, 36 reported that these strategies decreased burden, 24 reported increased burden as a result, and 19 reported mixed results, meaning some effects had an increase in the burden versus in some had a decrease. In this table, we've highlighted some of the specific free text responses regarding the additional documentation strategies. So I won't go through rows 1 and 2 because they don't appear to require much more additional information. But in row 3, we have an interesting example. So charting by exception was noted in the survey elsewhere that it had an effect on decreasing burden, but at least one respondent mentioned that in their institution, charting by exception increased burden, and this was because some important information was left out of their EHR, and this ended up causing delays in their workflow. An example that decreased burden was limiting screening. So this was achieved through automating record review and only bringing forward the need to do additional screening if information was not already recorded in the record. And as we move ahead in the symposium, these responses demonstrate the importance of thinking through and closely monitoring burden reduction strategies. So in conclusion, overall, we found that within the survey, there was anecdotal support for multiple documentation reduction strategies. There was a high prevalence of policy changes occurring within healthcare organizations. Telehealth strategies were particularly common and noted to be highly rated for their impact on reducing burden. We wanted to mention that we'll be pursuing a more rigorous analysis of the survey results in the hopes for a potential publication in the near future, so stay tuned. And at this point, that kind of concludes our presentation. I'll turn it over to Kenrick to see if we have any survey-related questions from the chat.
Yes, thank you, Gene. One of the issues that someone's brought up in the chat is the issue of boilerplates and notes and it causing note bloat. So I guess their question is, did that come up in the survey results?
Yeah, so we did see that in that previous slide I just went over, we saw that for some these disease-specific documentation templates did have an effect of increasing burden, but some of this, the survey really showed that we can have conflicting results depending on the exact nature of the implementation or the changes that was made, and also how this was affected by institutional policies. So I think it's important to closely monitor how the changes or how new strategies are affecting burden overall.
Okay, great. So that really was the only direct question right now.
Thank you everyone for participating in the survey, and we look forward to sharing further results.
Thank you.